Smile greetings. You are watching my channel, Learn Sujok for free, and I am Tejal Uppal. Friends, this is the second course with 9 videos to be done in order to learn Sujok. In this course, you will learn the techniques of massage and moxibustion, which are very important tools for healing in Sujok. You must watch my videos in the order that they are given chronologically and also watch each video till the end. Only then will you truly gain from this course. If you like my videos, then subscribe to my channel and press the bell icon next to it.
Okay, once you have found the painful point, the best way to activate it is to massage it nicely till curative waves are released for 1 to 2 minutes. And when you feel or the patient says that the pain is slightly reduced, then only apply seed on that point. The painful point should be found with lots of patience in the whole area with probe, keeping the probe vertical, never horizontal. Press one point and then give the patient time to respond, and then go to the next point, again pause, and then the next point. We usually don't succeed in finding the painful point because we are in a hurry. So for example, if you have some problem in your eye, okay, say in your right eye, so, or whichever eye, because I'm going to demonstrate on the left hand, so I cannot take the left and right. So let me just show you. For example, you have pain in the eye. All right. So you start looking for a painful point here in this area. Press it vertically like this, never horizontally. Press it like this, one point, then the other point like that, then the other point. And the person might say, okay, it is paining, but he's not saying ouch. Now, when you press the actual painful point, the person will say, ouch, it'll hurt a lot, much more than the other points. And this is how very patiently press, release, press, release. Give the person or give yourself time to respond to the pressing. Only then you will be able to identify exactly which point is paining, because the point is very minute and it has to be found very patiently. Sometimes if you can't find a painful point, then we should just massage the area with a roller jimmy or some jimmy, like even with this jimmy, if you just massage it like this, little bit, that area, just massage it like this to warm that surface so that the points are loosened. Sometimes the painful point is so deeply embedded that it might not be easily identified. But when you do this massage in that area like this, when you just massage it like this, and this becomes warm, this area, then the points are loosened and they dissolve and the painful point comes up. Then you will be able to easily find the painful point. Our destination or our aim is to find the boss or the master point. Okay, the master point of pain among the surrounding points. Now, when you are looking for the eye point, you'll press here, wait, the patient might say, or you might feel pain, 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 slowly, slowly, pain, pain, in the whole area, just keep doing this. And then when you hit the painful point, you will say, or the patient will say, ouch, that the pain was more than the other points. That is the painful point. And, our goal is to create curative waves. So good and efficient qualitative and quantitative massage has to be given once the point has been identified. Once the point has been identified, mark it like this with a white pen or some pen. Just mark it like this. Okay. And after finding the point, hold the point with the vertical jimmy for a few seconds. Like the moment you find the point, ouch, like this, don't release it. Just hold it. Hold it for a few seconds. Don't start rolling or massaging immediately, as then the point gets lost and the curative waves also get lost. So just hold it there for a few seconds. Then massage the point for 1 to 2 minutes. And don't apply the seed, especially in pain symptoms, till the patient says that the pain is reduced. Like when you find the painful point and you hold it like that and you start, then later on you start massaging it for 1 or 2 minutes, 20 to 30% of the time, or sometimes even 50% of the time, the pain reduces to that much extent. 20% to 30% pain reduces. And this proves that the point is correct. So once you are absolutely convinced after massaging the point that the point is correct and it has actually influenced your pain and reduced it, then you apply the seed in it or the magnet on it in order to give it constant massage. How the seed has to be applied and for how long, you will see in the seed and magnet blueprint course. For the time being, this is what I wanted to convey. Now, also, there are different types of probe massage with the Jimmy that you can do. Let me just share my screen and show it to you once, how they can be done. Okay. All right. The first kind is a linear massage, which is up and down. It can be top to bottom for when food is stuck in throat. Or in case if the food is stuck and you want the food to come out, then that means this is the throat and this is your neck and, going down to the chest, and this is your mouth, right? So you want the food to come out of the mouth, right? I hope you can see my hand. Better, I think. Okay. So if the food is stuck in the throat, what you can do is you can do linear massage. Massage it from here till there, from down to up, like that, like that. So what is this doing? This linear massage is pushing the food out of your throat into your mouth so that it can be thrown out. So this is a linear massage. Or it can be bottom to up for when nauseous, like, not able to vomit, same thing. You just have to apply your intelligence. If you want the food or the vomit to come out, you're nauseous and the vomit is not coming. So then if you just massage this area with a linear massage with a probe like this, the vomit will come out or the food that is stuck in the throat will come out. The second type of massage is clockwise or anti-clockwise. Like clockwise is like opening a lock and letting energy come in. So, for example, when eyes are weak, now this is the eye point in the main correspondence system, right? So if eyes are weak, what would you do? The relevant eye points can be massaged clockwise. So what you will do is clockwise massage is like this, that you are, massaging in the clockwise direction. So both the eyes can be massaged like this in the clockwise direction. So this is to, basically for eyes that are weak, or also for hypothyroidism. Now, for example, if a person has hypothyroidism, that means the thyroid is not functioning properly. So you can massage clockwise on the thyroid point. This is the thyroid gland point. So massage, like this. Or you can massage it because it's a bigger area in the main correspondence system. You can massage it with a thicker probe. But if you're doing it in the finger correspondence system, this is the thyroid point. So just massage this point like this, clockwise direction. But if a person has, say, conjunctivitis, okay, that means that time you have to release the energy. So then the eye point should be massaged anti-clockwise. So this is how it will be anti-clockwise, whichever eyes, or if both eyes have conjunctivitis in the finger correspondence system or in the main correspondence system, you will basically massage it like this. Then the third kind of massage is the zigzag massage. Zigzag massage is done when you are not sure whether the energy has to be collected or released. For example, if you have tooth pain, okay. Now, if you have tooth pain, if you have tooth pain, you don't know or throat pain or headache, you don't know whether the energy has to be released or not. So once you found the tooth, so this is the mouth, the teeth are here also, right? So supposing you found the tooth in the whichever area it is, so then you can just do zigzag massage like this, like that. So it is neither linear nor clockwise or anti-clockwise, just zigzag massage, so that the tooth and the surrounding gum area and the mouth area is basically, they are all getting massaged, and then you will apply seeds on it. Even in case of headache, it is very difficult to identify exactly which point is paining. So on the head area, you can just, do zigzag massage, or in the finger correspondence system like this, you can do the zigzag massage like that. The fourth kind of massage with the probe is the pumping or repetitive pressing massage. This can be done when you are not sure whether the energy has to be collected or released again. For example, in tooth pain or headache or whatever, either you do the zigzag massage if the area is big, or if you're very sure, like this is the eye point, or this is the particular tooth point in the finger correspondence system. Okay, but you're not sure the energy has to be released or what. So what you do is just press the point. Once you found the painful point, press the point like this for a few seconds, and then do repeated pressing like this. Press and release. This is pumping. This is repetitive pressing movement. So this is how you do the fourth kind of massage with the probe. So these are all the 4 kinds of massages that you can do, and depending on what you are massaging and what kind of massage would be appropriate for that particular point or area. When massaging with roller, one more thing, when massaging with a roller or the side of the jimmy, on this, for example, like if you have cervical pain, okay, so this is the cervical area. So if you are massaging with this, the side of the jimmy, you can massage the cervical area like this, so that all the surrounding area gets massaged. You see how I'm doing? Like that. So just massage it like that, the cervical area, with the probe. So this you can do till it becomes pink, and you can actually keep touching it, and when you touch it, you will come to know that it has become warm, and then you apply the seeds. It should be warm enough so that it should stay warm for a few seconds or a minute, so that, when you apply seeds, they are on a warm skin. Your seed patti, or the seeds on the tape should be prepared first of all, then massage this, and straight away when it's warm, just apply the seeds. Do not wet the hand or press, do not wet the hands once the seeds have been applied or once the massage has been done. And after the seeds have been applied, then you have to keep pressing those seeds in between, whenever you get time, just keep pressing them, so that you're giving constant massage to the area that you are treating. Now, massaging with hand only, when you just massage, like you can even massage just with your hand, massaging with the hand only doesn't make it as warm as when you do it with the jimmy. But there is one positive thing to do massage with the hand. With the hand, you can transfer your smile intention to heal. Remember, in Sujok, the consciousness is very important. You have to be consciously wanting to treat or heal that area. So be a mother spirit with intention to cure. Then touch therapy works wonders. So if you're doing with the hand, just be, very lovingly, very nicely, and then your touch therapy, it will become warm also, and this touch therapy will work very well, and then you apply the seeds. But then the massage has to be a little deep, so that, it's nicely massaged, like when you would do it with a probe. To find a painful point on the foot, you can use the thick plastic probe, this one, because, the skin of the foot is harder, one thing, and also more sensitive. So if you use this thin probe, then it might hurt. So it is better to use a thick probe like this if you have to find a painful point on the foot. Sometimes patient can't tolerate continuous jabbing of probe on the painful point. Now, like for example, I was telling you about this eye point. If the problem in the eye is severe, and when you find the painful point and you try and do repetitive pressing or this kind of massage, the patient might not be able to, or you might not be able to tolerate it, because the pain might be much. Then what you should do, just find the point and hold it. Just keep your probe on the point for 1 minute, giving steady pressure for 1 to 2 minutes, or give very short rhythmic pressure, very short, press and release. So every time we attack the same point. But if it's very painful, sometimes just pressing it, keeping it pressed also works very well. When you do zigzag massage, that also should be done only on the painful point. Now, for example, if you have to do zigzag massage here, this has to be done on the painful point. If you do the massage like this, that means your probe is moving away from the painful point, let me just share my screen and show this to you, because this is very important. 1 minute. Now, for example, when you are doing zigzag massage, like this is the painful point. So instead of massaging it like this, like this, where you are moving your probe from one place to the other, because this way you are not actually massaging the painful point. What you need to do is hold the point, the painful point, and then do zigzag. That means your probe is not actually moving away from the point. What it's doing is it is massaging the point, holding the point. So I hope you understand that the point has to be held, because the point is what has to be massaged, not the whole area. This is wrong. This is not correct zigzag massage. No, the correct zigzag massage is holding the point and massaging it in the zigzag manner. So I hope you understood how to do that. And just do not release the point. So don't go too far on the side. Also, for chronic diseases, you should do anti-clockwise massage on the yang side to tonify, and do clockwise massage on yin side to tonify. Now, this is different. Like for chronic diseases, if you massage on the yin side, if there is a chronic problem in the eye, then you will do clockwise massage on this side. But on the yang side, if you do, then you will do anti-clockwise. This is one thing. And make sure when you do the clockwise massage also, it should not be done like this. You should hold the point and do the massage. Hold the point. Remember to hold the point in all kinds of massage. Do not release the point. If you start doing clockwise or anti-clockwise on the surrounding points, that is not going to be any use. You have to hold the point and then do the massage. So the probe is not moving from one place to the other. It's just the point you are giving it a massage in the clockwise or anti-clockwise, way. For example, if you have chronic gas or acidity in the stomach, okay, now in the finger correspondence system, this is the left hand, so the stomach would be on the left side, so in the lower phalanx. So this is the stomach area, right? Now if you have gas and acidity, so then this whole stomach needs to be massaged. So you could do, because it is a chronic gas and acidity problem, and it is you're treating on the yin side because the stomach point is on the yin side, so you will do clockwise massage in the same way. So clockwise massage will be done like this. But if the pain is in the lower back, then you obviously have to, and it's a constant lower back pain, then it is in the yang area. So in the yang area, if you find a point in the lower back, then don't do clockwise, then you have to do anti-clockwise massage over here, anti-clockwise. Now for acute diseases, for example, for a sore throat, which is an acute problem, it's a short-term problem. Find the painful point on the throat area. On this throat area, you can find a painful point in the main correspondence system, and we will sedate, so massage in anti-clockwise direction, because now we have to release the energy, because the throat is like, it is a sore throat problem, so we have to release the energy. So here we will not do clockwise, we will do anti-clockwise when we find the point. Anti-clockwise to release the energy so that the soreness in the throat is released. Usually for most diseases or problems, we activate the area or points by massaging them using one of the techniques that I have told you. But in some cases, it may be required to do moxibustion afterwards or instead of massaging. In the next segment, I will be sharing with you how and when moxibustion is to be done. The action step for you now is to collect all the massage tools and practice the techniques of massaging that I have guided you. The massage tools are all available in acupressure shops or can be procured online from Amazon, etc. So get active, collect them. See you in the next video. Thank you.